roll.
Okay. Welcome to Family Medicine in 5. Today we are going to talk about one of the most common things we see in family practice, and that is sore throat. The most common cause of sore throat is actually postnasal drip. So people have colds or allergies and all of that congestion runs down the back of their throat and causes a sore throat. But we do worry about other things as well, one of which is mono, strep throat, hand, foot, mouth, thrush, even some scary things like epiglottitis or a peritonsillar abscess. So a lot of times in family practice, one of the main important things is history. We got to talk to the patient and find out, when did it start? Has this been brewing for a while? Did it come on suddenly? Have you been with others who are sick? What other symptoms have you had? Have you been coughing? Do you have a history of allergies? Do you have a fever? Have you been traveling? Even sexual activity in the right patient population is an important question. And then we do a physical exam. So there's a lot of things we can glean from what it looks like. So rash is a huge thing. If the patient has a rash and they're a kid, it might be scarlet fever. Many times the kids will come in and they don't have that bad of a sore throat, but they've got a rash and even a tummy ache, and strep is one of my number one things I need to check. And then we check the lymph nodes. So strep throat has these anterior cervical nodes that are swollen, but mono will have these as well, but they'll have axillary nodes, so nodes in the armpit that are swollen, and inguinal nodes, so nodes along the groin, that will be swollen as well. And then what do the tonsils look like? Is there pus on them? Are they asymmetric? Is one bigger than the other? So if it's big enough that it's pushing the uvula to the side, we worry about a peritonsillar abscess, and that can be an emergency. We're going to send them to the ER, and as with any abscess, we're going to cut this open and get the pus out. Sometimes in these patients that have these abscesses, you'll hear stridor. So you'll actually hear that whistling sound as they're breathing because their airway is a little bit obstructed. Sometimes with the tonsils, you'll see stones on there, and stones can look like these little white dots on there. And how you get a stone is the tonsils actually can be fairly cryptic, so they can have these like grooves in them, and food will get stuck in there and debris, and it will harden up and become this firm stone, and so it causes a sore throat. And it's great because all you have to do to fix it is get that stone out of there. And patients that have repeated stones sometimes will have bad breath, and we'll often get them into ENT to just have them removed. If you see herpetic lesions on the back of the throat, so they look like little blisters or even like little canker sores on the very back of the throat or the uvula, that's often a sign of hand, foot, mouth disease. The little kids that come in like that will have many times they'll have sores around their mouth, like scabs around their mouth, and then a lot of what we call coryza, which is congestion and cough as well. Another thing that we look at the back of the throat is some petechiae, so little red dots at the very posterior palate, so the very back of the throat, and that's a sign of strep as well. So when we're worried about strep and we think, okay, this is likely strep, there's actually something called Centaur Criteria, and that's 4 things that we look at to see if they're positive, there's a 60% chance that it's strep. It's negative, then there's an 80% chance it's not strep. So it's better ruling it out. So the 4 things in Centaur Criteria are exudate on the tonsils, so that congestion, pus on the tonsils. If you have those cervical nodes that are swollen, these anterior ones, so right along the front of the throat. If there is a fever, then that's the 3rd step. And the 4th is the absence of cough. So if a patient has a cough and a sore throat, it's likely not strep. How we check for strep is we do a culture. Most places have a rapid strep culture, and that can be anywhere from 70 to 90% accurate. So it's not 100%. A lot depends on how the throat is swabbed. And so when we swab a throat, we want to really get the tonsils well, but we want to avoid the tongue or other mucous membranes. When you have a little kid that you're fighting with, it can be really hard to get a good strep culture. But if the culture is negative, then sometimes it could be just from a poor swab. And so that's why with my kids, I always send a backup culture. With kids, strep throat can actually cause rheumatic fever, so it can actually damage the heart. And so it's super important that we make sure that they don't have that. And so anybody under 18, the standard of care is to always send a backup culture to make sure it's not strep. And hopefully that will grab the poor swab if we've got that part of it. We'll show you how it's done in just a minute. The treatment for strep is actually penicillin. So we use a lot of amoxicillin, which is an oral medicine. You're going to take it twice a day for about 10 days. But I really like penicillin G, which is an injection. I know nobody loves a shot, but it actually works so great, and then it's one and done. We know a lot of folks don't finish out those 10 days, and that's why we see a lot of antibacterial resistance, and so that's why the shot is just awesome. Let's talk about what's going to happen when you go to the clinic to be tested for strep. So we're going to need a tongue depressor, and we're going to need a swab. So I'm going to have my cute patient open her mouth, and you can see that sometimes it's a little difficult to see what's at the back of the throat. And so we always ask patients to say ah, say ah. And it actually drops the tongue flat and it raises the back of the throat, the palate. And so we can get a much better look. So we'll have you say ah for me. We're going to push the tongue down and swab both sides of the throat. We actually try not to swab the tongue or the inside of the mouth because sometimes that interferes with a good test. Okay, shout out to Savannah for being my patient today, and thank you for watching. We'll see you next time.